everyone. I'm sure you know now currently the hottest topic in town is about Covid-19, the new virus. So currently there are many information out there which is difficult for us to tell which is true and which is fake. But luckily for us today, we have two doctors from ASP Medical Group, Dr. Tamili and also Dr. Sarveni, who will shed some light on this hot topic and try to clear our doubts. Hi doctors, I think for most of us, what is the most important question that all of us have on our mind is, how do we know if we have COVID-19?
First, you have to understand the term PUI or patient under investigation. If you have fever and or upper respiratory tract infection symptoms like cough, sore throat or shortness of breath, and if you fulfill either one of the criteria, which is if you have traveled or resided in the pandemic infected countries such as China, South Korea, Japan, Italy or Iran in the 14 days prior to your onset of symptoms, or if you have close contact with a patient who has been deemed positive with COVID-19, then you are PUI. But to be confirmed that you are a positive patient with COVID-19, you must do the necessary laboratory investigation to be certain.
So doctor, for us to be confirmed with COVID-19, we need to do a testing, correct? But where can we get tested?
If you fulfill the PUI criteria as I mentioned earlier, then you can call or contact the nearest district health clinic or hospital.
Thank you, doctor. I think the next question would be, if let's say we are sick now, having fever or any coughing, shortness of breath, does it mean that I have COVID-19 already?
That is a very good question. A lot of people are asking me, hi doctor, I'm having a fever, sore throat, difficult breathing. Am I having COVID-19? Actually, the answer is no, because you don't have history of close contact with COVID-19 patient and you don't come back from pandemic country, which is mentioned by Dr. Sarveni before.
How can I tell if, let's say, I have a history of contact with people who have just traveled or is a confirmed positive patient?
That's a very good question indeed, because at the moment I believe most of us are panicking, not knowing who around us has been tested positive for COVID-19. For your information, the Ministry of Health actively tracks down close contacts of people who have been tested positive for COVID-19. So your friend or your acquaintance should inform you if he or she has been tested positive for COVID-19 or if he or she has been a close contact and is being deemed PUI at the moment. So, if you have been in contact with such people, it's highly advisable that you take precaution measures and practice social distancing to be on the safe side.
So what should we do if, let's say, our family members or colleagues doesn't disclose to us that he or she is actually a PUI?
If you have any symptoms such as fever or upper respiratory infection like cough, sore throat, shortness of breath, it's understandable that you may be a bit alarmed at the moment. So what you can do is perhaps you can inquire your close contacts if they have traveled to the affected countries in the past 14 days or if they have had any close contact with a patient who have been tested positive for COVID-19. So if you have symptoms, what you should be doing is that you should isolate yourself at home. Kindly avoid any close contact with your family members. Avoid going out unless it's absolutely necessary. And what else that you should be doing is please practice the precaution measures and self-hygiene at home.
So what should I do if, let's say, I am ordered to be quarantined at home?
You should keep yourself in the room for all time. The room preferably have an attached bathroom and with good ventilation. If you want to take meal, you should use disposable utensil. If you want to throw the utensil, make sure you throw into a plastic bag with 2 layers, and you should wash your clothes separately. Keep yourself a distance from your family members and your housemate at least for 14 days.
Thank you, Dr. Tamili and Dr. Sarveni, for these insightful views. Unfortunately, that's all the time we have now for today. This is a difficult time for all of us, but to all Malaysians out there, I'm sure we can fight this war together. Let's just all do our part, keep clean, stay safe, and also stay home. Thank you.